Welcome to Dementia and Alzheimer's Disease, a family guide to understanding and advocacy. Structured across 8 modules, Introduction to Dementia and Alzheimer's, Recognizing Early Signs of Cognitive Decline, the Diagnostic Process, Understanding Disease Progression, Treatment and Management Options, Caregiving Fundamentals, Advocating for Your Loved One, and Living Well with Dementia. This course provides a comprehensive exploration of dementia with a focus on Alzheimer's disease, covering its biology, diagnosis, treatment, caregiving, and societal impact. Today, we'll dive into Alzheimer's disease, the most common form of dementia, exploring its definition, history, and key characteristics. This lesson will set the foundation for understanding Alzheimer's in the context of our broader course. So let's get started with a clear picture of what Alzheimer's disease is. Alzheimer's disease is a progressive brain disorder that gradually destroys memory and thinking skills, eventually affecting the ability to carry out even simple tasks. It accounts for 60 to 80% of dementia cases, making it the leading cause. Unlike normal aging, where minor memory lapses may occur, Alzheimer's involves significant and persistent cognitive decline. For example, someone with Alzheimer's may forget recent conversations or get lost in familiar places. And as the disease progresses, it impacts language, problem solving, and behavior, profoundly affecting individuals and their families. Let's explore how Alzheimer's was first identified to better understand its historical context. The story of Alzheimer's disease begins with Dr. Alois Alzheimer, a German psychiatrist. In 1906, he studied a patient named August Dieter, who exhibited severe memory loss, confusion, and behavioral changes at just 51 years old. After her death, Dr. Alzheimer examined her brain and found abnormal protein deposits, amyloid plaques, and neurofibrillary tangles, which are now hallmark features of the disease. In 1910, his colleague Emil Kraepelin named the condition Alzheimer's disease. This discovery laid the groundwork for modern research, and today these plaques and tangles remain central to understanding Alzheimer's pathology. Next, let's look at how Alzheimer's differs from other dementias. Alzheimer's is one of many types of dementia, so it's important to distinguish it from others. Alzheimer's typically has a gradual onset, with early symptoms centered on memory loss, such as forgetting names or recent events. It is driven by the buildup of amyloid plaques and tau tangles in the brain. In contrast, vascular dementia often starts suddenly after a stroke, affecting planning and judgment. Lewy body dementia involves hallucinations and motor issues like tremors, while frontotemporal dementia, which often strikes younger individuals, impacts personality and language. Understanding these differences helps with accurate diagnosis and care planning. Now let's examine the stages of Alzheimer's progression. Alzheimer's progresses through distinct stages. In the preclinical stage, brain changes like plaque buildup begin, but there are no noticeable symptoms. In the mild stage, individuals may forget recent events or struggle with planning, yet they can often live independently. The moderate stage brings more pronounced memory loss and confusion, requiring help with daily tasks like dressing or managing finances. In the severe stage, communication is minimal, and individuals need full-time care as they lose the ability to respond to their environment. Each stage presents unique challenges for patients and caregivers. Now let's explore the biological underpinnings of these changes. Alzheimer's fundamentally alters the brain. Amyloid plaques made of beta amyloid protein accumulate between neurons, disrupting their communication. Neurofibrillary tangles formed by abnormal tau protein tangle inside neurons, blocking nutrient transport and causing cell death. Over time, the brain shrinks, particularly in the hippocampus and cortex, which are critical for memory and learning. Additionally, levels of acetylcholine, a neurotransmitter vital for cognition, drops significantly. These changes drive the symptoms we observe and are key targets for research and treatment development. Next, we'll discuss risk factors for Alzheimer's. While Alzheimer's has no single cause, certain factors increase risk. Non-modifiable factors include age. Risk doubles every 5 years after 65. And genetics, such as carrying the APOE4 gene variant. A family history of Alzheimer's also raises risk. However, modifiable factors offer hope for prevention. Managing cardiovascular health, like controlling blood pressure or diabetes, is crucial, as is adopting a healthy lifestyle with a balanced diet, regular exercise, and avoiding smoking. Staying mentally active through learning or puzzles may also help. Understanding these factors empowers us to take proactive steps. Let's wrap up with key takeaways. Alzheimer's is a complex, progressive disease that accounts for most dementia cases. Its discovery by Dr. Alzheimer revealed plaques and tangles as key features, distinguishing it from other dementias like vascular or Lewy body dementia. The disease progresses through stages, from symptoms-free brain changes to severe impairment requiring full-time care. While age and genetics play a role, lifestyle choices can influence risk. This overview sets the stage for our next lesson, where we'll explore the prevalence and global impact of Alzheimer's. Thank you for engaging with Lesson 2. In Lesson 3, we'll shift our focus to the prevalence and global impact of Alzheimer's disease. We'll examine how it affects populations across different regions, its economic burden, and its challenges to healthcare systems. I look forward to seeing you in Lesson 3 as we continue our journey to understand Alzheimer's and dementia.